Welcome, everybody. This is Tracey Campanini, Deputy Secretary for the Office of Child Development and Early Learning. Thank you for watching this webinar. The content is appropriate as an overview for all early childhood stakeholders. Joining me today.
Hello, this is Tanya Vasquez, the Director of the Bureau of Child Care Certification.
Many child care closed during the stay-at-home orders that were issued by Governor Wolf. Approximately 20% of our child care facilities remained open during those stay-at-home orders. As counties move from red to yellow phases, many child care operators have questions about what moving to yellow means for them. Before we get into that information, let's just talk about what's been happening during the past several weeks related to COVID-19. As of May 5th, many providers continued to operate either under a waiver or were providers that were not required to have a waiver. Close to 1,529 providers have continued to operate. This has changed as providers are really making the decision based on what their families' needs are or whether they have adequate demand for childcare in their space to remain open. During the stay-at-home period and also as counties move into yellow, the decision for a child care operator to open or remain open is an individual one. One of the questions that many people have is what has the impacts of COVID-19 been on the child care space? We're collecting data on that routinely. And as of the beginning of March, when the stay-at-home orders began to be issued, there have only been 10 confirmed cases of COVID-19 in child care. We have been getting a lot of questions from families and from providers related to what are the impacts and how vulnerable are children during this time. So this is a slide that has been given to us by the Pennsylvania Department of Health that talks about the information that the Center for Disease Control and Prevention have been seeing, as well as a study that's being connected or convened by the Harvard Medical School. And what we're seeing is COVID-19 has very limited impacts on children's health. Additionally, the Secretary of the Department of Health, Dr. Rachel Levine, conducts daily press briefings. They issued on May 4th some statistics about the confirmed cases in Pennsylvania. For children under the age of 18, less than 3% of the confirmed cases have impacted young children. During the shutdown or the stay-at-home period, we've talked about the fact that child care centers or those group child cares that operate outside of a residence submitted a waiver request if they wanted to continue to operate. As I mentioned earlier, many of those providers might have changed their minds based on what they were seeing as demand in their community. During the waiver process, there's also been a lot of conversation or questions around what does it mean to be an essential service worker? And our position in the Office of Child Development has been if a parent is required to work during the shutdown period, so that now is the red phase, those families should be able to access safe and stable childcare. So for any business that remains on the governor's life-sustaining business list, any business that was granted a waiver to remain open during shutdown, federal, state, and local government employees, and all of those essential employers such as grocery store clerks, home health aides, transportation, first responders, those are all families that need care. That will continue under the red phase. Any child care provider who wants to operate during red will be required to maintain a waiver to operate. But as we move to yellow, child care providers can reopen at their discretion. Now I'm going to hand it off to Tanya to talk about the yellow phases.
There have been a lot of questions from providers who are in the northwest and north central areas of the state that are going to go yellow on May 8th, according to the governor's new directive. A lot of questions from providers have been asked to OCDEL whether they are required to open or do they have to open. Providers are not required to open on May 8th, and if a provider is going to consider opening their childcare business, there are considerations that they really do need to weigh. Considerations such as your staffing. Staff is a critical component of your childcare operation. You'll need to ascertain if all of your staff are able and ready to return to work, or are you going to be in a position where you will have to hire new staff? You'll also have to ascertain if your staff have any issues that may compromise their ability to work during COVID-19. OCDEL has also received a lot of questions regarding space, specifically regarding their capacity, regarding their group size, regarding limitations to the number of children that are going to be permitted in their childcare facility. There are no current guidelines that specify that you must reduce your capacity. Your current license capacity remains as it is. Although there is no limitation to group size, you must familiarize yourself with CDC guidelines. Guidelines pertaining to specifically trying to keep siblings together, trying to maintain staff with the same group of children throughout the day. The idea is to keep children together and the staff together and not have them float from room to room, but to maintain your grouping in your childcare space throughout the day. There's also consideration as far as the access to PPE. Are you going to have access to an adequate supply of gloves and masks and sanitizing and disinfectant wipes? You routinely sanitize toys, diaper areas, facility surfaces on a regular routine day prior to COVID-19. You will find that you're doing even more sanitizing and disinfecting if you open. And you do need to ascertain that you will have an adequate amount of supplies in order to be able to maintain your facility safely. Will you have sufficient food supply, particularly if you're going to be preparing meals for the children? There are requirements that children receive required food groupings for their breakfast and lunches. So you'll need to make sure that you do have sufficient amount of food supply if you're reopening your facility. And another question that OCDEL has received from many providers at this time is, what is my liability if I reopen my facility? OCDEL really is not in a position to answer this question for you. It is an issue that warrants discussion with an attorney and your insurer. Now, again, as I said, you are not required to reopen your facility, as there are a host of considerations you must make during this time. OCDEL, however, is going to assume that within the next 2 to 4 weeks that all of those facilities in the yellow region of the state will be reopened. What we ask you to do is, if you decide that you are going to remain closed, please report your closure. Even if you reported it already, please report your closure again to the RA account, because all of the facilities in the yellow counties will now be posted on the DHS website as open and providing care. So as parents return to work in your area, they will have your name, your address, and assume that you're operating. So again, if you decide to remain closed, please report your closure. If you decide, as some operators have, that they just cannot sustain during this time and that they plan to permanently close the facility, if that is the choice you make, please report that to the facility closure resource account and also to your regional certification office. You will need to submit a written notice of your closure, and you should return your certificate of compliance. Now, if your county is able to go to yellow and then green, and for some reason has to be returned to red, then again, if you wish to remain open during that time, you will have to apply for a waiver through OCDEL to be able to continue to provide service for the children in your county should you return to red.
So one of the points of clarification that we'd like to talk about is the guidance that we're following as we reopen childcare or for childcares that have remained open during COVID-19. One of the places that we get expert guidance is from the Centers for Disease Control and Prevention, known as the CDC. They have the most up-to-date comprehensive information available. And that information changes as we learn more and more about COVID-19. We know a lot of stakeholders and providers are interested in what this office might promulgate in terms of policy or guidance around operations. But we feel that it's best to depend on those experts at the CDC. We explicitly have been sharing information under the heading Guidance for Childcare that Remain Open. So when we refer to this guidance, many of the pieces of information that we're providing to you in this webinar or in some of the other webinars that we have available is really reviewing that CDC guidance. One of the questions that we are also asked frequently is, in the opening information that's been sent out from the governor and from Secretary Levine at the Department of Health, it talks about the policies around business and worker safety. They make recommendations about restricting the number of staff or perhaps the number of clients or customers that are engaging in those reopened businesses. That policy is not applicable to childcare. So that raises a question for many people about what does social distancing look like and the prevention of the spread of COVID-19 for childcare. Tanya referenced some of this earlier about managing group sizes. Social distancing in childcare is more about keeping groups of children together throughout the day, keeping the staff that you have assigned to work with those groups of children consistent and not having them float throughout the facility. Right now, the current recommendations for childcare is that staff and children over the age of 2 wear cloth face masks. We are deferring to expert opinion from the CDC, but also OCDEL has been collaborating with the Children's Hospital of Philadelphia, most commonly known as CHOP, and a panel of pediatricians from the Pennsylvania American Academy of Pediatrics. They are consistent in their recommendations right now that masking occur. This is a high level of inquiry and interest from providers that are open. So we will be providing some follow-up support through the PA Key resources about masking for childcare providers. Group sizes are not required to change right now. And again, that's one of the things that's sort of confusing about the overarching business reopening versus the information that's being shared specific to childcare. We're not changing capacity, and we really want to clarify the issue of outside play. Ventilation and outside play is actually very positive in the attempts to not spread COVID-19. The spacing that children experience when playing outside and fresh air is actually a good thing.
We're going to talk about regulatory compliance. Just want to make it very clear that there are some regulations that are non-negotiable. Staff-child ratio is expected to be in compliance at all times. We will not lax any of the ratios for the children. So again, it is essential that if you are opening for business that you do and can meet the staff-to-child ratio required by regulation. Your staff health assessments are also still required. So if you are hiring a new person, that staff person or anyone who might be preparing food in your facility must have a health assessment within 12 months prior to providing initial service. And that health assessment is valid for 24 months. So if you have returning staff, you do need to be in compliance. If they have to have an updated health assessment, they will be expected to have that information on file. Tuberculosis screening is also required at initial employment. So again, if you're hiring new staff as you open, when certification does resume our inspections, we will be expecting to see those documents on file at your facility. Clearances, particularly your Pennsylvania State Police clearance, the National Sex Offender Registry, which is the NSOR, and the Child Line or Child Abuse Registry clearance. They are required of all newly hired staff, and they are required to be renewed for any staff who is coming up upon their 60 months of renewal. These clearances are still being processed, and they are being processed in a timely fashion. Now, we've also had a lot of questions about, are there any regulations that you are going to suspend? And I can inform you that under the governor's proclamation, OCDEL did submit a list of regulatory suspensions. Those would involve the annual training requirements for the 6 hours of professional development. It also would pertain to an individual staff person who was due to have their first aid recertified, but their class was canceled because of COVID-19. There are also suspensions surrounding the child health assessment and the child service reports, and some record keeping as it pertains to the children's files, such as updating the agreement and the emergency contact information and the child service reports. There was also, in addition, the letter to the local traffic safety authorities. As I said, these are currently being reviewed for consideration, and OCDEL will definitely provide further guidance on the regulatory suspensions upon approval. There's also proposed legislation. It's under House Bill 360. This is specific to the FBI fingerprinting. It does not involve any of the other clearances, as I said, the NSOR, the Child Abuse Pennsylvania State Police clearance, as well as if there's any required clearances from out of state. It does not pertain to them, so I don't want to confuse you. House Bill 360 is only referencing the FBI fingerprinting. And there is legislation that would suspend the requirement for an individual to have an FBI clearance, and for those individuals that need to have their FBI clearance renewed in 60 months. Again, as I receive updates, child care providers will be informed via listserv. So make sure you're registered for listserv. And I know we've been putting a lot of information out through our listserv. It is important information, and I encourage you to please read the listserv announcements that you get. So currently, the OCDEL, in addition to all DHS licensing offices, we have suspended any type of renewal inspections at this time. COVID-19 has required the department to examine a number of practices, and one of those has been the renewal inspection. So I did want to mention, though, for those inspections that have passed, the annual renewal date, OCDEL will be communicating with providers once the inspections are resumed. I would also encourage you as a provider, if you had an inspection conducted prior to suspension of the inspection process and you have plans of correction to implement, you should contact your certification rep upon resuming operations and formulate a plan for verification of the plans of correction that you've implemented or you will be implementing now that you've resumed your operation. And OCDEL certification continues to investigate any complaints that are received in the regional offices. And again, we will provide notification in advance of any startup of the renewal inspection process. So we've also had a lot of questions about school-age children. So yes, we know that schools are not in session at this time, and parents need care for school-age children as well. School-age children are permitted to be in childcare facilities. However, if your facility operated in a school building, we really refer you to the Pennsylvania Department of Education and the local school district at this time regarding building access. We know that many providers have told us they are not going to be able to have their program in a school building. OCDEL does have an emergency relocation in place. This pertains to a childcare facility that may have to relocate all or part of its operation due to an emergency. We have protocols in place for this process, and if this does pertain to you, please reach out to your local regional certification office and have this discussion with your certification rep about an emergency relocation.
One of the solutions that we have been supporting for school-age children now is the resumption of part-day school-age programs that are licensed exempt. So we've been reaching out and trying to connect with those programs that typically operate over the summer months. Part-day school-age programs can resume as counties are moving into yellow. Because they are typically not licensed by the Department of Human Services or Education or the Department of Health, we are working to put out guidance that's based on the CDC guidance for operation during COVID-19 to those entities as well. So they will be permitted to restore their operations if they're able to adhere to the recommended social distancing and supportive health practices over their time period. So this is a big issue. We know that some licensed child care providers have auxiliary programs that they operate, and we would encourage you to think about whether or not it's appropriate for you to resume those services as well. And if you'd like to talk about them, our office is providing messaging and coordination to the extent that we can to those programs in order to help meet the demand for school-age children. Another question that we've been receiving is, as the public school systems were closed, they engaged in virtual or distance practices to support the continuity of education. And so we've received questions from child care providers is, are they required or expected to continue the continuity of education that children have been doing while they've been staying at home with their parents? And we don't have any strong guidance about making that a requirement. To the greatest extent possible, if you have the capacity to coordinate in your local community and you have a relationship with your school, you can certainly explore those opportunities to support those school-age children as part of their program. We leave that individual decision to your organization, and if you choose to try to engage with your public schools and need support doing that, we are happy to help make those connections if necessary, but we're not mandating that requirement.
We also want to let you know that there is a multitude of resources available for providers. We know that you have a lot of questions regarding health and safety issues. There are recordings available on the PA Key that are guidance for school and childcare. And there was a webinar last week that Amy Requar, who is the health consultant with the PA Key, she has recorded a webinar both for childcare centers that remain open, as well as our family childcare homes and group homes. And those are available to you via the PA Key. If you go on PA Key website, again, there is just a multitude of resources that are available to you.
So one of the things that we wanted to clarify, if you were expecting us to go in depth about health and safety practices, these recordings are already available, so we will not be covering those specific instances in this webinar, which we're getting ready to wrap up. We would encourage you to select the appropriate webinar and view it. Again, these webinars were developed based on the CDC guidance to child cares that remain open, and there are just some slight nuances depending on what the implications of those recommendations would be for provider size. So viewing these webinars and familiarizing yourself with the recommendations that the CDC has put out are critical as you're thinking about whether reopening is right for your child care.
Some providers have asked what they should do if they are made aware of either a suspected exposure or a confirmed case of COVID-19 in their facility. There is guidance for childcare providers for this purpose. There are 2 websites that are available to you. And I would also encourage you to reach out to the Department of Health for guidance. Please also report this to your regional certification office, as we are tracking the number of confirmed cases of COVID in childcare facilities. And additionally, we've referenced the CDC throughout the webinar. We do encourage providers to review the guidance on the CDC website. There is multiple resources of guidance. There is guidance that pertains to childcare facilities who are operating during COVID-19. So again, you must familiarize yourself with this guidance if you are going to reopen your facility. It is imperative that you follow the CDC guidance to maintain a safe environment for your children, for your staff, for yourself, and for your families. There's also information available through the Pennsylvania Department of Health, as well as the DHS website and the PA Key.
Before we leave this slide, I would just want to clarify, the Department of Health has some great resources that are available that are more simplified. They have some flyers and resources that might be relevant for you in terms of posting information. And they also link back and refer to the CDC website. So I just want to reinforce why we're making the recommendations that the CDC is the source of trusted information. As they get more in-depth understanding of what this virus and its impacts are, the information is frequently updated. And We want people to have access to the most current information around childcare. So we will continue to reinforce the link to that CDC guidance for childcares that remain open. So one of the things that we are going to continue to do is to develop and post frequently asked questions. We will continue to have the provider calls with Amy Requa and as necessary certification and other health experts. So you can submit your health-related questions to operations to the email that's displayed on the screen right now. So that information will be evaluated and included in the planning for the messaging that you all are looking to receive related to making decisions to operate or questions that you have if you do begin to operate again and start to identify where you need more information. Also, your certification representative is also another trusted source of information. And again, in this time, we're dealing with new practices and policies, and if we can't get you the answer immediately, we will loop back around and get you the information as quickly as possible. As we conclude our remarks and move into ending this webinar, I'd just like to acknowledge that in times of emergency such as this COVID-19 pandemic, we are really striving to support you and families to the greatest extent possible. And we are taking feedback that we receive from the field, from the advocacy organizations, from our staff, and constantly evaluating it. And because of that, sometimes we need to update policies or information to be responsive to the needs of the Commonwealth and our stakeholders. So we just wanted to acknowledge that things might change, and that's just the circumstances of living through this disaster or emergency, as you would talk about it. And we will continue to share information and update our resources as it's appropriate. As you're thinking about reopening, we recognize that this is new and unfamiliar territory, so thank you for your thoughtful consideration, for the support that you're giving your families and your staff at a local level, and as we can, to the extent possible, we will do what we can to support you. Thank you and best wishes as you make these decisions.